What is your opinion on ADR?
Artificial disc replacement. It's a great question. So there's been a lot of literature that's been progressive over the past 10 to 15 years, let's say. The gold standard for treatment of disc disease in the neck, in the cervical spine, has been what's called the ACDF, which is the anterior cervical discectomy and fusion. And that has been a very successful surgery, and it's become essentially the gold standard of treatment. Over the course of the past 15 years, they've developed disc replacement technology that's been progressively improving. And the disc replacement technology is a disc that actually is implanted and has movement. It's done in the cervical spine and in the lumbar spine, but it's more commonly done in the cervical spine. At this juncture, there's a couple of companies that have been FDA approved for 2 levels in the United States, but if you travel outside the United States to places like Germany, they're doing 3 and 4 levels. Now, I've seen a lot of complications with those patients. I've actually had patients who've needed to have them removed and fused because of development of abnormal motion in the neck, significant facet pain. Over the course of time, the literature has shown that the long-term data on 1 and 2 level anterior cervical discectomy and fusion and 1 and 2 level disc replacements have somewhat stabilized and become, relatively speaking, similar. And there's a lot of back and forth discussion on that we don't have to necessarily get into that debate. What I have found is that for ADRs, you have to have stringent patient selection. And I've become much more stringent in my patient selection because I have found over time, patients have developed neck pain after ADR. And that neck pain, I think, comes from disc replacement devices that have an abnormal motion that the facet complexes in the back of the neck really don't like. And so there have been patients who I've done disc replacement x-rays and everything have looked good from a flexion, extension, side bending standpoint, but they've developed neck pain. You remove the ADR and convert it into a fusion, and the neck pain goes away. So I attribute that to the facets being abnormally moved with the ADR. And so I've become more stringent in my patient selection. There's a lot of debate over ACDF versus ADR, but I tend to use ADR quite a bit. However, I like to stick to 1 level because I have seen more oftentimes than not neck pain that has developed from multi-level ADR. And my criteria is very strict, and I discuss that on a patient-by-patient basis using many factors. But it is a very important tool. We do use it. We will continue to use it. And I think the technology is going to continue to evolve in that space over time. And I think the debates are always going to be very interesting regarding ACDF, which is a fusion, and ADR, which is a disc replacement.